So Mr. Bishop came into us about, what, a week and a half ago?
Just about, yeah.
Just about a week and a half ago.
I hadn't seen a doctor or chiropractor since November, December, January, February, March, 5 months. Believe me when I tell you, I was hurting when I came in here. I hurt a little bit in here, but I'm walking better. I sit better. And
at least you can stand better too, right?
yes.
Yeah, getting up, because one of the bigger issue that we have when a patient comes to us with a inflamed disc. Luckily, Mr. Bishop doesn't have any radiating or referring pain down his leg as much as the typical neurological patient, but he did have a lot of weakness in his legs and a lot of severe spasm. So we are trying to unlock the low back by doing a lot of functional neurotherapy maneuvers on him. So this is one of the ones that we have him do. So we're gonna have you arch your back for me, Mr. Bishop. Cross your arms across your chest for me, sir. And I'm actually gonna have you turn to the right side for me, please, as far as you can. So what we're trying to do is trying to get him to rotate to the right side as far as he can, okay? And we're gonna actually have you push to the left side for me, Mr. Bishop. Resist against my hand here.
Yeah.
Good. And hold it for 2 or 3 seconds for me, and turn to the right side for me, Mr. Bishop, again, as far as you can. Nice job. Go ahead and resist again for me, please. And relax for me. Go to the right side again for me. And all we're doing here is trying to unlock basically the rotators or the trunk muscles or the extensors of the low back muscles to try to get them to move a little bit better. So our goal is to get them to sit and get up without pain. Push left again here for me, sir. And go right for me, please, as far as you can, sir. Of course, this is a very good technique too to unlock the trunk, the lower trunk, for people that play a lot of golf and tennis too, but more specifically with people who plays golf. So now, sometimes patient will spasm again on us here, but most of the time it's more sore than it is then it will spasm. So push left again for me, Mr. Bishop, one more time. And turn to the right side for me, sir, as far as you can. There we go. Good. All right, let's say you go back to neutral position for me. All right, and take a deep breath. Get a little breather. And we'll have you go the opposite direction. Go to the left side for me as far as you can. So once we engage and get to the end range of motion, we're actually going to have you do the same thing. Resist against my right hand here, please. Go ahead. And go left for me, Ms. Bishop. Good. Resist against my hand. And go left for me, sir, as far as you can. Good, Ms. Bishop. One more time. And go left again for me, Mr. Bishop, as far as you can. Nice job, sir. Keep breathing for me. Don't hold your breath. So again, this is a really cool and pretty effective way of decreasing spasm, which is a guarding mechanism on patients who have a very hot or inflamed disc. Push it right against my hand here, sir. And go left again for me, sir, as far as you can. Nice job. So after that, I'm going to have Mr. Bishop arch his back again. Go back to neutral position and go ahead and let me see you stand up, Mr. Bishop. You can use your hands if you want to, but try not to use your hands if you don't have to, okay? Arch your back, head up, and lean forward. Put all the weight on your legs. Perfect. There we go. Someone who is in a very guarded state with regard to the mechanics of the low back, it is very difficult for them to get up from a seated position. So we're actually going to have you do again for me, Mr. Bishop, one more time.
Sit.
Yes, please. And we have you arch your back, head up. Good. Perfect. So all we're doing is emulating the patient doing a squat. Okay? And which is a proper lifting technique, by the way. So again, arch back in for me, and lean forward, head up for me, and stand up for me. Good, Mr. Bishop. Nicely done, sir. All right.